Dr. Phillip Koren. I'm a cardiologist, and I trained as a interventional cardiologist. And so that's the doctor who does cardiac procedures and takes care of people having heart attacks. But I also am a clinical cardiologist and take care of patients in the office. I'm the medical director of the Cooper Heart Institute and also the medical director of the Cooper Inspira Cardiac Care program as well. My other title here is I'm Associate Chief Medical Officer for the health system or Cooper University Healthcare. I'm involved with a lot of the ambulatory strategy and our growth. And as we grow to new areas and develop new relationships, I play an integral role in those relationships. Imagine if you take care of someone having a heart attack and they're really ill, and then you see them through that. Those types of relationships are lifelong. And the relationship that you and the trust that you developed with that person and their family is something that just doesn't go away. And I can think of many anecdotes and many patients that I've continued to follow that I've known for many years, and see them get older with me. And we age together. And sometimes that's difficult, but it's very rewarding to go through life changes together with your patients. Those relationships are forever, and they're very cherished for both the patients, I think, and for me. One experience when I was young in my career, I was probably in my mid-30s, and this patient was flown in having a massive heart attack, was quite ill. And as he was being wheeled into the cath lab, he took out a little picture, and on the picture was him, and his 3 kids. And he said, "Doc, I need you to save my life for them." And I I sort of swallowed my tears that I was ready to choke on myself. And I realized that, he depends on me. And behind this person is really a real life family or people. It really grounds us in that the person that we care for, usually they're awake, but sometimes they're unconscious when they're very ill. That person is not just alone in this fight with heart disease, but they have an entire family and a caring group of people behind them. It's very dramatic sometimes. I wanted to be an architect when I was a kid, and growing up, I would draw up architectural plans of homes that I was going to have at some point. None of them happened, but my dad discouraged me. He had a heart attack when I was 19 years old. And when I was 19 years old, he said to me, "You got to go to medical school." And so I listened to him. I went to medical school. I no longer became an architect. Cooper is the best story that's never been told. I I was in private practice for many years, and I lived in the community. And about 10 years ago, I came on to work full time for Cooper. I feel that what we do here every day is take care of our own patients and our own people in Southern New Jersey, from the local Camden community to the suburban community to the rural communities of New Jersey. I mean, New Jersey is an interesting state in that there's a lot of different type of demographic patients, ethnicities, and backgrounds. And so here at Cooper, we're a real melting pot of what New Jersey really represents. It's really an exciting place to be. And I think our future and our growth is just endless, looking at the potential for where we can go over the next several years. So I think Cooper, as an organization, as a healthcare delivery system, as an academic medical center, is really a great place to invest your time, money, and investment in the future.